What if your body was trying to warn you and you didn't realize it? As a doctor, I've learned something important. Most serious conditions don't start with dramatic symptoms. They begin with signs people dismiss. They ignore them, they explain them away, they wait, and sometimes they wait too long. Today I want to share some symptoms that deserve attention, not to create fear, but to create awareness. Because your body often whispers before it screams. Hi, this is Dr. Gani. One of the most common things I hear from patients is, I thought it would go away. And sometimes it does, but sometimes that symptom was an important clue. The good news is that most symptoms are not emergencies, but some symptoms deserve attention, especially when they're new, persistent, worsening, or unusual for you. So let's talk about them. Number one is chest pain. Chest pain is one symptom I never want people to ignore, especially if it is new, severe, associated with shortness of breath, or if it comes with sweating, dizziness, or nausea. Not all chest pain is heart-related though, but it should never be dismissed without evaluation. Number two is stroke. Stroke symptoms are sudden weakness, sudden numbness, difficulty speaking, facial dropping, loss of balance. These can be warning signs of a stroke. And in stroke care, time matters the most. Number three is unexpected bleeding. Blood where it should not be. Blood in the stool, blood in the urine, persistent, unexplained bleeding. These symptoms deserve attention. Now let's talk about the signs people often dismiss. Number one, severe headache. A headache that feels different from your usual headache. A sudden severe headache or headache associated with neurological symptoms. Those deserve medical attention. Your body knows what is normal for you, so pay attention when something feels different. Number two is shortness of breath. Many people slowly adapt to worsening symptoms. They tell themselves, I'm just getting older, or I'm out of shape. But if walking upstairs suddenly feels harder, or everyday activities leave you breathless, that's worth discussing with your doctor. Number three, difficulty swallowing. Food getting stuck, pain when swallowing, a persistent sensation that something is not right. These are symptoms that deserve evaluation. How about the silent symptoms? Now let's talk about symptoms that worry doctors because they're often ignored by patients. Number one is fatigue. Not simply being tired after a long day, but persistent fatigue. Weeks or months of exhaustion, feeling drained despite rest. Sometimes fatigue is the first clue that something else is going on. Number two, unexplained weight loss. If you're losing weight without trying, don't simply celebrate the number. Ask why that is happening. Your body may be sending an important message. Number three, loss of appetite. When food no longer interests you, when eating becomes a chore, when appetite changes significantly, that deserves attention. Number four, night sweats. Waking up repeatedly drenching in sweat. Not because the room is hot, not because of extra blanket. Persistent night sweats are something doctors take seriously. Number five, memory changes. Forgetting things occasionally is common, but significant changes in memory, thinking, or concentration deserve evaluation, especially if family members notice changes too. Now, I will leave you with the most important lesson. If you remember one thing from this video, remember this. Most symptoms do not mean something serious, but persistent symptoms deserve attention. The goal is not panic. The goal is awareness. You know your body better than anyone else. You know what feels normal, and you know when something feels different. Trust that instinct. One of the biggest mistakes I see in people doubting themselves. They think it's probably nothing. I'm probably overreacting. I wait a few more months. Sometimes that's okay, but sometimes one conversation, one appointment, one question can make all the difference. Listen to your body, because your body often gives you clues long before bigger problems develop.